Addiction then is physiological dependence is often
Yeah.
a big part of that addiction,
Right.
but addiction
Right.
is that change in the brain that then causes compulsivity, compulsive use
Exactly.
despite harm. And so it literally puts the brain into a survival state. So the way a physician friend of mine describes it, he'd been a surgeon and he said, I'll do a procedure and my folks are recovering in the hospital and they're going to be on opiates for post-operative pain, and sometimes they'll become dependent on them. And some patients will say, this is the worst feeling in the world as they're coming off of it. They're experiencing withdrawal. They'll say, don't ever put me on this drug again. That's someone who's become dependent, but without the brain change of addiction. Patient next door will say, this is terrible. I need more and more and more and more. And
And that's exactly it.
that's the
Exactly
difference.
what you said is the craving and the compulsivity,
Yes.
as you mentioned, is more the addiction.
And it's
Most
not.
of the people I work with don't have that. Most of the people I work with don't have the compulsivity. They don't have the craving for the drug. They have the effects of the symptoms from coming off the drug, but that's separate from having this compulsion to take the medication. They take the medication because they're afraid of these symptoms they're
That's right.
experiencing coming off. Yeah,
Both are medical conditions. The key I want to make sure that we say
absolutely.
both, neither
Yeah.
one is about being strong or weak or smart or
Yes.
good or bad. They are both just medical conditions.